Good day, Warren County, and a warm greeting to all on this cold morning in February, Groundhog Day. Our tasks continue, as you know, and our challenges are still great as we combat this ever-evolving COVID-19 virus and the mutated variants that are now giving us issues. Local numbers continue to improve, but we've had far too many deaths in Warren County and across the region. Together, we all grieve over these losses, and our prayers are extended to all those who are suffering from the ravages of this terrible disease. There is new hope on the horizon, however. Tennessee and Warren County has been blessed to receive the early rollout vaccine distribution, and so we're well on our way to mitigating this disease over the long haul. We know it's been a long process. It's been nearly a year since the virus attacked our community, our nation, and the world. Our local health department has done a great diligent job in combating the disease, doing the testing, and distributing the vaccines. We are now through phases 1A1, 1A2, 1B, and now the 70-plus population is also receiving the vaccine. You can still go online for appointments. You can go to the link on my county executive webpage or phone my office at 931-473-2505 for information, or call the 866-442-5301 number to set up an appointment with the local health department. Today we have as our guest Dr. Michelle Fiscus. She's a pediatric specialist, a graduate of Indiana University. She's the medical director of the Tennessee Department of Health's Vaccine and Preventable Disease and Immunization program. She's known as the vaccine guru across the state, and Dr. Piercy and she work very hard together in order to make sure that the public health and safety and well-being of every resident in Tennessee has been addressed. So we want to welcome to our show today, I know you're known as Dr. Shelley Fix Us, so we want to welcome you today and hope you're well. And I know the issues, as we joked earlier, it feels like every day is a Groundhog Day now. So we will address it on a day-to-day basis as we have been. So if you'd like to just describe a little bit about the vaccine plan that's now out there and what some of the phases mean and where the state is right now. I know a lot of people are confused because some counties are ahead of others and some counties got vaccines before others did. So anything you can do to kind of explain that to our listeners today will go a long way in disseminating that information across the Upper Cumberland.
Sure. Good morning. I appreciate the opportunity to be with you and your listeners this morning. That name Fiscus, when I was in pediatric practice, became Dr. Fix Us from my little patients, and so that sort of stuck and is now my Twitter handle. So it's great to be with you this morning, and I know that this whole vaccine rollout is a very complex and pretty confusing process for everybody. So I appreciate the opportunity to give some clarity on this. So, many of you have probably already seen the plan, or at least parts of the plan that the state put out on October the 16th of this year, and we're now in our fourth iteration of that plan that's posted online. And really what we designed along with the governor and the Unified Command Group is a strategy to really try to get the people who are in the populations that are driving hospitalizations and deaths in the state of Tennessee vaccinated first. And so that's those phased plans that you see. And so the phase 1A population was to protect the hospital infrastructure, because we needed to make sure that we had people in the hospitals who could be able to care for people, not only those who were sick from COVID-19, but for all the other diseases that didn't stop because of COVID-19. And then also those individuals who are in long-term care facilities, nursing homes and assisted living centers, homes for the aged, and their staff of those facilities, to make sure that we could stop the deaths that were occurring in those nursing homes. And then to our first responders who have suffered greatly in being exposed while they're out in the public doing their job every day. So that was really the focus of that first phase, is to get those individuals vaccinated. And then the second part of that first phase is to get the outpatient healthcare providers vaccinated, not just the medical providers, but the behavioral health providers and the dentists and others who are involved in outpatient medicine, even in the transport of patients from place to place, to make sure that those other frontline individuals were also, able to maintain being able to care for patients and also prevent them from getting sick in themselves. And partway through this, we realized that we really needed to continue to prioritize those older Tennesseans who are so much more likely to suffer from serious outcomes or even death from COVID-19. And so we instituted these age-based phases as well. And so not only can you meet criteria to get vaccinated early because of a risk that's posed by your job or where you're living, but also just because of your age, you're able to get vaccine early on. So we started out with individuals who are age 75 and older, made our way in a large part through being able to offer vaccines to those populations, and then as of today have moved to opening that up to individuals who are ages 70 and older. And some of our large metro areas like the Shelby County area where Memphis is, or Davidson County where Nashville is, they may lag a little bit on opening up those extra age ranges just because of the size of the populations that they're dealing with. But for the most part, any individual who is age 70 or older in the state should be able to at least get in line at this point to get a vaccine. And as you mentioned, the sign up for that is largely online, but there are also numbers available if you're not someone who uses the internet widely, where you can go and just make a phone call to be able to get in line to get a vaccine.
So what's been some of the biggest challenges over the last couple of weeks for the Department of Health and the distribution of the vaccines?
There's been a few challenges. The biggest one is that we're just not getting enough. So far we've had about enough vaccine to vaccinate about 7% of the population, which is just not enough. And that's, we're waiting on larger numbers of doses from the feds, so that we have some understanding of, how much vaccine we can push out to our partners. And those vaccines are largely going to the health departments, but then also to some hospital partners that are willing to vaccinate the public, people outside of just their patient population. And now, as of this last week, we've also been able to start sending out vaccines to small independent pharmacies in especially rural counties, and also to our safety net providers, so to the federally qualified health clinics, and also to some of the community health centers that are particularly involved with reaching those individuals who might be overlooked. So folks who are ages 75 and older who might be experiencing homelessness or might not have access to health care, we want to make sure that we're able to get the same access to vaccine for them as to someone who might be in a situation where they're readily able to get in their car and go get a vaccine.
There's been a couple of questions and stuff that I've had is there going to be any attempt to do any large-scale vaccinations and drive-throughs like some of the other states have had, and some discussion in some of the larger urban areas? So will they be like maybe the possibility of using a school campus to do open vaccinations down the road somewhere? Or are we going to concentrate on allowing the healthcare providers, health departments, clinics, and hospitals do most of the distribution?
Yeah, it's kind of a yes-and situation. So there are mass vaccination sites that have been stood up and will continue to be stood up. So in Nashville, they've opened the Music City Center. That's done through the Nashville Department of Health. In Memphis, they've stood up the stadium there as a mass vaccination site. And FEMA, the Federal Emergency Management Agency, is offering their support to states, both with staff members who can come and assist, and also with materials and supplies that can be used in those kinds of centers to assist states in being able to stand those up. And so you can run a mass vaccination center pretty well in a large urban area if you have the vaccine to be able to give to that center, and that's one of the problems right now, is that we don't have enough vaccine to be able to consistently run a very high throughput mass vaccination center like that. The other issue is that those mass vaccination centers don't reach every population in a state like Tennessee, which is largely rural. So it's one thing to do that in Arizona, where the vast majority of people that are being vaccinated live in one of two metropolitan areas. But in Tennessee, we have such sprawl that it's really important that, yes, we can set up mass vaccination sites in urban areas, but we also have to have the access in rural areas. And so we've worked really hard to make sure that our distribution of vaccine doesn't take away from our ability to get access to those rural areas that need to get that vaccine. And it may be too much to expect someone from Warren County to drive to Nashville to a mass vaccination site. We need to make sure that we have vaccines available in Warren County for the people of Warren County too. So we're working hard to make sure that we keep both types of opportunity open for folks in Tennessee.
So I didn't know what the relationship was with the Department of Health and St. Thomas Ascension, because they own our hospital here, River Park Hospital, and the CEO, Dale Humphrey, has received, of course, vaccines. And I know, there was some discussion about letting some of the larger hospitals and their subsidiaries in rural communities also help distribute the vaccine. So is that still part of the plan?
It is. It's very county dependent and hospital system dependent. So we have some hospital partners that have really built vaccination machines where they can really move a large number of individuals through and get them vaccinated, and are really just limited by the supply that we're able to give them. And then we have other hospital partners that maybe just wanted to vaccinate their healthcare worker population and then remove themselves from this process, and others that are working very closely with their local departments of health to continue to vaccinate. So we have given vaccines to the River Park Hospital when they've asked for them, and as the allocation to Warren County has allowed us to be able to do that. We've also been able to provide some vaccines to some of the small independent pharmacies in Warren County, so that they can reach out to individuals that may not be able to go to the health department or get a vaccine from the hospital. So really trying to increase the number of opportunities that there are within a county to be able to get a vaccine when you're in phase, so that we can turn that around as quickly as we can. The health departments are also in the process of rolling out a better scheduling system. If you've tried to schedule with a health department, you've seen that right now they're basically using Sign Up Genius, which is typically used to figure out who's going to bring what to a potluck. And it was a platform that we were able to take advantage of and stand up really quickly, but it's not a good long-term solution. So that has served its purpose to be able to get people in line, to get a call from the health department to schedule their vaccines. February the 10th, we're told Microsoft will be rolling out a new scheduling platform for us, where people will be able to go in and actually schedule an appointment in the application with the health department, and that should also assist in getting those appointments and getting that access to be a little more streamlined than maybe what it has been at the beginning of this rollout.
And that will be a welcome blessing, believe me. I can't wait for that to happen. There's been some question about second doses. Some people say, well, one dose is good enough, and if I don't get the second dose, I will be okay, or probably be okay. If you could speak on the importance of getting that booster vaccine, that second dose, and how important it is to build up that immunity, or at least that protection from the Pfizer and the Moderna.
Yeah, that was a really important message, so thank you for bringing that up. So, we do know that first dose of vaccine provides some protection. And that protection may actually be pretty good for a period of time. The problem is we don't know how long that's going to last. And typically with vaccines, with pretty much any vaccine that you've ever received, you get one dose, and then you really need a second dose or sometimes even a third dose of a vaccine to really be able to build that long-term immunity in your body with your immune system. And so the concern is if you only get one dose, it's possible that you could have some short-lived protection, but we don't know what that looks like in a month or 2 months or 6 months. And so it's really, really important to take the time to make sure that you go and get that second dose. We'd like it to be as close to the due date as possible. So if you get the Pfizer vaccine, then you should be getting your second dose about 21 days after that first dose. If you received the Moderna vaccine, it should be about 28 days after. If you don't know which one you got, you should have a card that you can look at that will tell you. And if you don't have a card, then the health department can look that up for you. Or anyone, when you go to get a second vaccine at those sites, should be able to look that up for you and let you know which vaccine you got and which one you're due for and when.
If you could discuss just a little bit about the mutated variants out there and what you feel like is the efficacy of the current vaccines to combat those new virus strains that are out there coming from South Africa and Brazil and the UK.
Sure. Yeah, it's viruses mutate. That's the unfortunate thing about them, and why things like flu are so hard to control with vaccines, because they are sneaky little buggers, and they switch around their genetic material and make different proteins and have different expressions, and sometimes that happens really quickly. So we have seen a couple of new variants of the SARS-CoV-2 virus, one out of the United Kingdom and one out of South Africa, and for the most part, the Pfizer and the Moderna vaccines seem to be holding pretty well with those variants. There is some chance that we might need another booster for the Moderna vaccine because of the variants, and so they're looking into that to see. But these two vaccines are so effective and have produced such a tremendous immunological response against the virus that even if it's lost a little bit of its efficacy against some of these variants, the immunity that it causes is still probably adequate to be able to protect you from that. But that's another reason to make sure that you get that second dose, because if we're going to start seeing these variants become the leading strains in the U.S., that's not what we have yet, but if that happens, then that extra amount of protection is going to be really important. There are a couple of vaccines that we expect to maybe see emergency use authorization from FDA over the next month or two. One is the Johnson & Johnson vaccine, which is a single-dose vaccine right now. It seems to be maybe a little less effective against some of these variants, and so it might need a booster dose. It's currently a one-dose vaccine. It may need to become a two-dose vaccine. And then the AstraZeneca vaccine that we might see sometime in March, we haven't seen much in the way of data yet, or at least not that I'm aware of yet, about efficacy against the variants. But I think the important message is that without a vaccine, you have no protection. So with a vaccine, you at least have some protection, and some is better than none. And we want to encourage everybody that can get a vaccine to get a vaccine to make sure that they're not only protecting themselves and their loved ones, but also helping to control this in the community so that we have less community spread and can get back to living the lives that we want to be living, and seeing and hugging our loved ones and being able to gather again.
And I saw a little news line from Dr. Fauci that he was confident that the millions of doses that are going to be needed to move us forward would become available within the next few months. Do you share that similar confidence, or are we having doubts now that some of our European pharmaceutical companies seem to appear to want to be hanging on to some of the doses that may have been promised over the last few months?
We have pretty limited insight into what's coming down the pike to us, but we've been assured by Pfizer and by Moderna and by the federal government and the administration that we're going to see those doses. So far, they have come through on promises that they've made around us beginning to see some small increases in Moderna allocations. We think that we will see some increases in Pfizer vaccine allocations around the middle of the month. So at this point, we don't have any reason to think that they won't continue to make good on those promises to get that vaccine out. And I think it's very much a priority of the administration to be able to get people protected as quickly as they can.
Well, one myth that I would like for you to kind of address or to discuss, some people think when they get the second dose, their life can be wide open again, no masks, they don't have to social distance, that they're completely immune and everything's going to be back to normal. So, what's your feelings on that, or what can we do to tell people that we still have challenges ahead and there's still vulnerable people, and that, the passage of the virus still can continue despite the second dose?
Yeah, definitely. And, so right now we have about 7% of the state that has had at least one dose. So that's 93% of the people that are around you haven't even had one dose of vaccine. And no vaccine is 100%. So, if you are surrounding yourself, if you are out in a large gathering, surrounded largely by unprotected individuals, then there's a pretty decent chance that you're going to get exposed to the virus, and it's possible that you could still get sick from that. It's also possible that you could get infected with it, not get sickened by it, and maybe still pass it on to other people in your household or in your community who are not yet protected with the vaccine. So it is really important that people continue to wear masks when they're out, that they continue to limit their gatherings, and make sure that they maintain their physical distancing, and then still make sure that if they're getting symptoms that are consistent with COVID-19, fever, chills, body aches, respiratory symptoms, that they think that they might still have COVID-19 and get tested and self-isolate until they're sure that that's not the case. If there is a small group of individuals, say there's, I know my mother, she plays Mahjong. She lives out on the plateau in Crossville, and she's 82. And she is, dying to get back to a couple of friends. And so what we've discussed is that, if her whole Mahjong group has been vaccinated, they're all over the age of 75, they all have access, they should have both doses of that vaccine, and then it should be at least 2 weeks after that second dose. And then if that small group of ladies that are all vaccinated fully, and none of them are feeling poorly, if they want to get together and play Mahjong, that's probably going to be okay. But we shouldn't have folks going out into the general community, into large gatherings, into large kind of super spreader events like we've seen, and thinking that their vaccine is going to protect them from getting infected. We just need to continue to be careful.
So what is your message to the group of folks out there who the anti-vaxxers? I know in your career as a pediatrician, you face that from parents there in Franklin not wanting to inoculate their children. So how do you address people, or what kind of message should we be delivering to people who are just absolutely anti-vaxxers and will have no part of this process?
Yeah, it's tough. So there's a couple of different groups of folks. So there are staunch anti-vaxxer, conspiracy theory folks who just, they're just not going to get vaccinated, it doesn't matter what. I usually try to point out to them that they've probably been fully vaccinated as children, but for whatever reason, they're not going to get this one. I'm not going to change their mind. And many of those people, unfortunately, are also anti-mask people, and so they're more likely to be to get infected, to spread it to others, and that's really, really unfortunate. It's hopefully still a small group of people that are just, absolutely against against vaccinations, or, truly anti-vax people. I think we have a lot of hesitant people, and I think that's very different. And hesitancy can be addressed with education. And the important thing for people who maybe are eligible to get the vaccine that are listening, or will be eligible soon, or they have loved ones that are asking them if they should get it, is that these vaccines are incredibly safe, and they are incredibly effective at preventing COVID-19, to the degree that in the studies, which have tens of thousands of people, in the studies for the Pfizer vaccine, for the Moderna vaccine, for the Johnson & Johnson vaccine that's coming, and the AstraZeneca vaccines, there has not been one hospitalization for COVID-19 amongst any study participants who received the vaccines in those studies, out of tens of thousands of people. And there has not been one death from COVID-19 among people who have been fully vaccinated in those studies. And there have not been any deaths that have been directly related to the vaccine. So your chance of getting COVID-19 and dying from COVID-19, or being hospitalized from COVID-19 are significantly greater than having anything bad happen to you from getting this vaccine. And so I can't say that more strongly, is that, we are in a situation where basically the choice is going to be you get vaccinated or you get COVID-19. And there's not going to really be a third option. These new variants are much more infectious. They're not more deadly, but they're more infectious. They're spread more easily. And so I know I personally have absolutely no interest in getting this virus. I am 52. I am overweight. I'm a healthcare provider. I know things won't look great for me if I get that vaccine. I have lots of friends who are diabetic or have hypertension or heart disease, where things won't look good for them if they don't get the vaccine and they get infected. And I think that's the choice that people need to be willing to make. And so weighing the risks and benefits, getting a vaccine that is incredibly safe and effective versus getting a virus where, as you are older or have comorbidities, health conditions, your chance of becoming sick, hospitalized, and potentially dying from the vaccine starts to increase significantly. I personally choose to get vaccinated.
And thank you for that word of encouragement, because we do have people that just are not interested. They just think they're gonna play Russian roulette with it, and they're gonna play it out, and it's not gonna happen to them. So, another question that I've received is, and my director of schools will be joining us later as well. When do you think that students are going to be able, particularly the older population, high school population students, will have access to the vaccines?
Well, right now, the Pfizer vaccine, which is the one that's a little bit fussier to deal with, it goes down to age 16. The Moderna vaccine is to age 18. Pfizer has kids as young as 12 in their studies right now, and Moderna is trying to recruit kids to be able to do the studies for younger ages. I haven't yet seen that there's been any kids involved in the studies for the J&J or the AstraZeneca vaccines, but I know they're all trying to recruit those populations. I would love to see the high school students vaccinated sooner rather than later, because they have been attending some of these big super spreader events, and they are quite social. I have a 17-year-old in my house who wrestles and is also quite social. So trying to curtail that can be challenging. But, the first thing that we have to do when we have limited doses is to get them to the people who are much more likely to die. So What we're hearing from the federal government is some cautious optimism that we might be able to start vaccinating kids late spring, early summer. I certainly hope that we're able to vaccinate both at least the high school population and the college age population by the end of summer before we start back to the 2021 school year. It would be wonderful if we could have teachers and students all vaccinated and not have the issues that we've had with college campuses and kids living in dorms and having to learn remotely. I really hope, and it's kind of a personal goal of mine, to be able to get those students vaccinated by the end of the summer.
And that's good. Any prospect for government employees and essential workers within government employment, such as sanitation workers?
We do. So those individuals that we consider critical infrastructure, so the stuff that has to go on around us, or the state stops functioning and people can't live their lives. So that's power and gas and sanitation and public transit and railways and airports. Those individuals fall into our critical infrastructure phases, which is phase 2. So they come right after. So 1A is the healthcare workers, first responders, long-term care facilities. 1B is teachers and some other first responders and other school staff. And then 1C is individuals who are chronically ill, who are age 16 and older, who have comorbidities like diabetes or hypertension, or undergoing cancer treatment. Those are the first priority of all of them. And then right after we finish phase 1, that ABC, then we move to phase 2. And phase 2 is the critical infrastructure workers. And so we've got some details of that in our online plan, but those would include those individuals, like you mentioned, sanitation and other things that they just have to keep moving in order for the state to keep working. We have to keep the lights on, the water moving, the sanitation being picked up, transportation going. So that's where those workers fall into A and B. And then when we get to phase 3, that is people who live in congregate care settings where it's more likely for the virus to be transmitted because they're living in really close quarters. So that's college dorms, and it's also our correction system where we've had thousands of cases in the correction system between inmates and also to those corrections workers that work in those facilities. So we want to make sure that those individuals who are living in those congregate care settings get protected as well.
And one question I had from a parent of a chronically ill child who's not able to attend school because of its medical challenges. Is there any hope that the parents of children who have cancer or have medical challenges being able to receive the vaccine in order to protect their child at home?
There is. So just a couple of weeks ago, we did an update to the plan that was on January 22nd. And in that 1C category where we have people who are 16 and older with chronic health conditions, we have now included the parents of what is termed medically fragile children in that category as well. So if you are a parent who has a child who's too young to be vaccinated, so they're under the age of 16, and they are considered medically fragile, so they are on a ventilator, have a tracheostomy, they require oxygen, or they're receiving chemotherapy, they have diabetes that needs medications to be controlled, they have a diagnosed immunodeficiency of some kind. There's a fairly extensive list of specifics around what constitutes a child who's medically fragile. But if you are the household resident or a caregiver of a child who falls into that category where they can't be vaccinated themselves and they're at really high risk, then we can vaccinate those parents and caregivers in phase 1C when the other folks with chronic diseases are able to access the vaccine.
Okay. And that clarifies the question that I had. So thank you very much. Now, one of the things that we've had a little challenge with locally, our numbers have gone down, but mostly because our testing has gone down. Some people think it's not necessary to test now. If they start getting symptoms, they probably know they're sick and they just kind of self-quarantine or go on their business if they don't have too many symptoms. If you could just address still the importance of testing and monitoring those results in order to keep the virus more contained, and being aware of the fact that we still have people that are spreading the disease out there who have not been tested.
Right, yeah, it's still really important to be tested, and the good news is that there are more and more places where you can get tested. So several of the large chain pharmacies like Walgreens and CVS, lots of walk-in clinics and doctors' offices now have testing, and then your local health department still has testing available as well, even if it may not be drive-through testing like you might be accustomed to seeing, but there's also self-testing, so you can go to your local health department and get a self-test kit. You swab your own nose, you put it in a tube, and it gets shipped off, and then you get notified of the response or the result of that test. So it's really, really important that we're still doing that testing so that we understand the disease burden. The good news is that while testing has dropped off, unfortunately, the hospitalizations have really dropped off.
Yes.
And so it does look like we are seeing less disease in Tennessee, because even if people aren't testing and looking for it, if it was still as bad as it was, we should continue to see those surges in hospitalizations and people requiring intensive care, and we have not seen that. There's actually been quite a precipitous drop-off of hospitalizations and the need for ICU over just the last 2-3 weeks or so. So we are seeing less serious disease for sure. But we are still seeing a lot of transmission out in the communities, and so if you are experiencing symptoms, even mild symptoms that make you think, I wonder if maybe I could have COVID, please go get a test and isolate yourself so that you're not spreading that to your loved ones and your neighbors.
And thank you for that, because that does go a long way in getting that message out to everyone. As we're kind of winding down here, is there anything you'd like to share, words of hope and wisdom and moving forward? What we can do as a county to assist your office and Commissioner Piercy and our local health department?
There are so many ways that people can assist. First by just getting the word out. If you're on social media, please talk about the importance of getting these vaccines. If you are eligible to get one, share that message with your friends and family. Take a picture. You can tag Department of Health, Tennessee Department of Health in that if you want to. Post it to any of the social media channels. We would love to see that. Encourage and help your neighbors and loved ones who may be eligible for vaccines, but maybe aren't internet savvy or aren't quite sure how to get a vaccine. Help them navigate online. Go to covid19.tn.gov. You can find all of the information there. That's covid19.tn.gov. Offer to give a ride to someone who may be elderly and needs to get a vaccine and maybe can't get to where those vaccines are. If there are ways to give a message in your church or your synagogue or some other social group that you're in, if you can help us reach underserved and minority populations who maybe are hesitant about getting vaccine and help spread the message that this is the way we get out of this. We have to get people vaccinated. We probably need 70 to 75% of us vaccinated, and since right now kids make up 24% of our population and can't get vaccinated, that means pretty much every single adult needs to get vaccinated. There is nothing scary about it. They are effective, they are safe, and millions, tens of millions of people have already gone before you all over the world to get these vaccines. So you're not the first in line. We've got lots and lots of data. That data gets better every single day, but we are not seeing anything scary coming out of these vaccines with tens of millions of doses even administered here in the United States. So please consider going in and getting in line when your time comes.
Well, we'll be closing up here soon, and I just want to thank you for joining us today. The information that you've shared has been extremely important, and this will be available for everyone to share as part of Bltv's live stream, and it's carried over all of our local media as well. So this will go a long way in sales pitching the importance of the vaccinations and continued testing and cooperating with the health department and the distribution of the vaccines across the region. So we want to thank you very much. I'll kind of leave with a quote from Bishop Desmond Tutu, who said, "Hope is being able to see that there is light despite all the darkness." And despite all the darkness that we've had over the last few months, I'm beginning to see light and promise and hope. And so your service to our state is very valuable. We appreciate your professionalism and the sharing of this information with us today. We'll stay in contact, email or call Dr. Piercy quite regularly. I know she's a busy lady, and her plate is full in most of what she does, but I know you've got a great team working together, and moving forward, the state of Tennessee is probably far ahead of some of our surrounding states in what we've been able to do. So thank you for your service, and you take care and you be safe.
Thanks so much for the opportunity.
So today we have other guests joining us today. We've got Justin Scott with the City of McMinnville Parks and Rec, and we have Grant Swallows, our Director of Schools. So Justin.
Thank you, Mr. Haley. Good morning. Again, Justin Scott here, Assistant Director from McMinnville Parks and Recreation. I want to briefly give you a few updates on our upcoming sports leagues. First and foremost, we're highly anticipating the completion of the Milner Recreation Center. Upon completion, we plan on starting our practices and our games for our McMinnville Youth Basketball League, which currently has roughly 319 kids signed up. We are also currently taking registrations for our McMinnville Youth Baseball and Softball League and our McMinnville Youth Soccer League. Registrations are being done online. We don't have any in-person registrations right now, and those are being done at our McMinnville Youth Soccer website. So if you go to our website, you can choose which league you're signing up for by hitting on the tab. Our registrations will end February the 20th. We are anticipating our soccer league to begin the first weekend in April. It plays 4 weeks, and our baseball and softball, we hope to start it at the end of April. We are trying to answer emails, post on Facebook. We're doing radio ads, just trying to get that information out there. So for more information regarding any of our youth sports, feel free to contact us at 931-473-1212 or visit our McMinnville Parks and Recreation Facebook page. Thank you.
Thank you, Justin. Thanks for the opportunity to be here, as always, to update you on the status of Warren County schools. Today is a first day of the week. We had a snow day yesterday, so glad to be back in school. Do want to update you on the health report that I give every week. We do have currently 17 students that are isolated, 107 in quarantine. Only 3 staff members are isolated and 6 are quarantined. Now, I just want to say that I'm not a scientist, but I believe just after listening to Dr. Fiscus, our numbers with our faculty and staff have been higher than that all the way throughout the year. But a good number of our staff have getting vaccinated, and most of them, or a lot of them, have received their second shot in the vaccination, and we have seen our numbers go down steadily since that time. And so I'm glad to see that. I appreciate our employees. I appreciate the health department. I appreciate our employees going and taking the lead and being leaders in that and getting their vaccinations. and we hope to continue to see our numbers remain low. Again, I've said this, that our desire is to stay in-person learning. You've seen that the governor has called for that throughout the state. You're actually seeing other districts that have been all remote beginning to open back up, Metro Nashville being one of those. We hope to remain in-person learning throughout the rest of this school year. Again, I'm asking you to help us with that and continuing to do all the things that we need to do to make sure that our county and our community stay healthy. Just a couple of other items of note. I want to say, I meant to say this last week when we had the Commissioner of Education, but I was actually under quarantine myself last week, so I had to join by phone. Last week was School Board Recognition Week, and I just want to say publicly on this forum, I've said it a couple of different places, how much I appreciate our school board in Warren County. What they do, they don't do it for the glory and for the accolades, but they do it because they want to serve our community, serve our school system, and serve our kids. And so I'm very thankful for the Warren County School Board, but also want to recognize a special group this week. It's National School Counselor Week. And so every school has a school counselor, and if you are listening to this, and I would encourage you to reach out to the school counselors in your school, in your district, or your area, and just thank them for what they've done, what they do. They have done a tremendous amount of work, just like all of us have done, all employees have done this year, and trying to help kids and make sure that we are serving them in the best way that we can. One more announcement, I guess more update that I've had questions about this week. The governor did rescind his executive order 74 last week. And that is specifically the part that talks about athletics. One of the biggest questions that I've gotten since that happened, and I believe even maybe, I have not seen the governor's press conference, but I believe there may have been a statement in that press conference that said we're going back, there are no more restrictions on athletic events. So that's a little bit misleading. Understand that rescinding that order, he was rescinding the very restrictive environment that he had put into place, where that only said that parents and household members and grandparents could attend. So that part has gone. We have now gone back to the restrictive environment of 1/3 capacity in our sporting venue. So just understand that we are just simply going back now to what we did before the more restrictive order. We still use GoFan for families to buy tickets. We still are operating under the distancing restrictions. We're still operating under the mask restrictions. We're still operating under all the things that we did before. We're just going back to that. I'm thankful for that. I'm thankful for the opportunity for more folks to be able to watch. I'm thankful for the fact that our cheerleaders and our dance teams get to participate in winter sports now. But again, I want to caution you, it's up to all of us to take that opportunity seriously and be responsible with it so that we do not have to go back to a more restrictive environment. I'm asking all fans, all folks that are attending our sporting events to wear your mask, sit with your family, distanced from other folks, and make sure that we are keeping our kids first by doing that, because we want them to be able to continue to have this experience and have an opportunity to compete. So I know we don't always want to do that. It's not always what we are used to. We would love to have full gyms and the everybody cheering and large crowds, but that's just simply not the time that we're in. So please protect our students. Please protect yourselves as you come into our school buildings. And so with that, I appreciate the opportunity to update you, and I'll turn it back over to County Executive Haley.
I want to thank our guests today, in particular Dr. Fiscus, for giving us updates on the rollout of the vaccinations across the state. So I want to thank Parks and Rec for giving us some updates. I'm in the process of working with the city to help maybe put together a countywide wellness program for county employees. So when the new Civic Center opens up, the Milner Center, we should be able to start negotiating or an MOU of some sort to help promote the safety and well-being and also the health of all of our county employees, as the city of McMinnville does with theirs. Of course, we appreciate the work of the school board, our teachers, the administrative staff at central office, our bus drivers, everyone that's in the support staff for our schools. Getting our kids back in school is extremely important to our community. With the new legislative session that the General Assembly went through with the governor's insistence, we'll have programs in place to try to bring up our children's test scores and reading abilities so that we do not get behind. And so educating our children to be a better workforce is part of the priorities of the state right now. And so we will be working diligently with the school superintendent, the county will, and the state in order to make these programs a reality across the summer and going into the next school term. My COVID preparedness team has worked very diligently over the last year. It's been hard. We've kind of been on our own. We've had to be proactive. We've had very little national and state guidelines at the very beginning, so we had to figure this out on our own. So we're proud of what we've done. We've received shout-outs for our accomplishments, but we still have tasks at hand. So I want to thank each and every group, every individual that's participated as part of my team. I also want to thank all of our messaging units, and so that we've been able to share information with the public, and that's been the key to our success. So PEG Broadcasting, our other media outlets, radio, and particularly Bltv that's allowed this show to be live streamed and sent across the Upper Cumberland has been an exceptional service. It's helped share the information that is pertinent and relevant to all the residents and citizens of the Upper Cumberland. Of course, we know nothing is easy and never has been in life. The hardest decisions are not always the easiest decisions. Our lives have been turned upside down. We realize that what we used to take for granted as simple things are not taken for granted anymore. It's made us rethink the whole process of life and moving forward and putting priorities on things that we didn't think were priorities before. Just having family get-togethers, funerals, other things that have been just a part of life and accepted have now been turned upside down. But we will continue. Americans are resilient, Tennesseans are resilient, Warren counties are resilient. We're a special place and we all understand that. As far as the county update, essential county government operations continue. We're working toward getting our admin building and the courthouse back open on Fridays again, but we have limited staff. So we'll still be the Monday through Thursday. If you'll call those individual offices to make sure or make an appointment on Friday. But our drive-through at the clerk's office for tag renewals will still be open Monday through Friday during regular business hours. We're working on also getting a drive-through for the trustee's office for tax payments. We still have a drop box. You can still go online. But once again, please call those individual offices or call my office at 931-473-2505 if you need to know which office you need to call, either set up an appointment or have the proper documents or information needed before you come to the buildings. The courthouse is still on special operations, particularly with trials. We're doing video arraignments and virtual trials as well, but all of those orders come from Supreme Court Justice Bivens from the state of Tennessee. Of course, the governor's executive orders continue. They're modified and there's daily updates. Much of this is shared as either links on my webpage or you can go on the Tennessee governor's page as well, or the Department of Health. So a state of emergency still continues through the end of February and will probably be continued, and that also includes a local face mask mandate. We realize this crisis is not over. It may drag out for at least the remainder of this year. We've made it thus far. We've made it together. We've gone through some of the worst ordeals, and there is hope and there is light. So we're encouraging still the same CDC and health guidelines. Wear the masks, social distance, avoid all those spreader events. Try to respect, once again, the health concerns of others. Personal hygiene. Keep your hands washed. Use a hand sanitizer. And please, once again, be patient with the health department and the healthcare providers that are out there trying to do their best to provide the health and medical treatments that are necessary, not only just for the regular folks, but also for our COVID patients. The General Assembly, the state of Tennessee, of course, is in session, and they'll be dealing with state issues and trying to channel new resources, particularly to rural communities. So we're anticipating some additional assistance to rural communities, not only for education, workforce development, but also moving forward with tourism and other initiatives as we return to a life of normal. Washington relief package may also be coming down. We're not sure exactly what's going to be sent and when those dollars will be returned, but we still have some more obstacles to face in Congress moving forward. To do a quote from Hippocrates, the early Greek doctor that set the medical standards that we still abide by today, healing is a matter of time, It sometimes is also a matter of opportunity. So as we move forward across the state and nation, across this region, and particularly across Warren County, we need to pursue every opportunity that we can to restore our lives to normal and to contain and mitigate and address this virus across the next year. Government cannot do everything, so we need your help and your support. We also need those support agencies and nonprofits and organizations that are out there doing a phenomenal job to help feed, provide transportation, or assist those that are less fortunate than others. Our home group is dealing a lot with homeless population. We realize that the growing number of evictions and people being displaced because of work, it's a growing problem not only across Warren County but across the country. So please help support all those agencies that are out there trying to stabilize the lives of others, particularly those that are in underserved markets and populations. So please to continue to support our health department. They're doing an exceptional job with the limited staff and the National Guard that's been there. They're still testing. They're still providing the vaccines, now into the second doses over the last week or so. But they're also still providing the regular services that the health department does with almost the same amount of staff members. So please be patient. I know the phone lines have oftentimes been clogged with calls, but just be patient and await the call once you're registered for them to call you in for a scheduled appointment to get either your first dose or second dose of the vaccine. So we can really continue to appreciate the support and the overall embracing of what we're needing to do across this county to contain this virus. We will continue to progress. We'll focus on the future. There's still much to accomplish, but there are great opportunities ahead. If we remain strong and dedicated and committed to doing what we have to do as a community and not get discouraged, we will ride out this storm and be better off for it. Hope itself, another quote, is like a star, not to be seen in the sunshine of prosperity, but only be discovered in the night of adversity. So we've had some of our darkest hours, our biggest challenges. We've had many people to lose family members to this virus. So we want to make sure that each and every person is taken care of, that each and every person feels committed to moving our community forward and feels a part of this plan. So thank you. Take care and be safe. We are Warren Strong.